Having scrubbed up, we now approach the gowning area. The key thing to remember is the hands are clean, but always keeping the arms vertical so that any dirty water drips off from the elbow. We have 2 sterile towels. We'll use the first towel to dry just the left hand, and starting with the fingers and the hand, drying down the forearm to the elbow, and then losing the towel. Using the second towel, we do exactly the same, but with the right hand, starting with the fingers, coming down the wrist, forearms to the elbow, and then losing it, keeping the hands upright and being careful not to touch anything else. At this point, we have a gown that's open. The key thing with a gown is you have a clean side, which is the part that will be sterile and approaching the patient. So taking the top of the gown with both hands, moving slightly away from the gowning table, just allowing the gown to drop by holding the top of the gown. Then, using both hands together in a simultaneous action, bring the hands into the sleeves, never allowing the fingers to come out from the end of the cuffs. This is the closed glove technique. We ask the assistant just to tighten the gown up to lift it over the shoulders. I have my undergloves, which are half a size larger. Open the gloves and then turn the gloves around, so rotation. So using my thumb lined up with the glove thumb point, I then take the glove and then use the supination action so that the glove is now sitting on my hand. With my other hand, I take the free edge of the glove and then with a little tug, pull the entire glove over the end of my sleeve. Then, by pulling slowly on the glove and the gown, the glove is then pulled and my hand advances out of the end of the sleeve into the glove. We use a similar action for the right hand. We have our gloves which have been rotated. I then pronate my hand, taking my thumb, lining it up, then supination, then taking my free edge, a little tug, and then the glove gets pulled over the end of the sleeve. By pulling slightly on the gown, my fingers will slowly advance into the glove. We do a similar action when we're putting the second pair of gloves on. Then using the thumb underneath the free edge of the cuff, supination, and then with a little tug, we're able to pass the glove over the hand, and just gently pulling on the cuff, you can bring the hand into the glove. Finally, with the right side, supination, a little tug, and so the hand can be advanced into the glove, and just by pulling on both gown and glove, you can make sure that the fingers are comfortable. To finish off the process, we will need to wrap around the gown. So with the assistant taking the free edge of the tie, then rotate, we then pass it around the back and then tie.